This is Max. After a great surfing session, he came back to shore, but as he stepped on a sharp shell, he suffered a deep cut on his foot. Cuts like these, especially near the beach, can carry a serious risk: tetanus. Tetanus is a dangerous infection caused by bacteria present in soil and water. To protect Max, the doctor decides to give him a tetanus toxoid, or injection. This injection is given intramuscularly directly into the muscle for effective protection. Before starting, the doctor prepares everything: a sterile syringe, vial, alcohol swab, gloves, and a sharps disposal box for injections in adults. The safest site is the deltoid muscle of the upper arm. This site ensures proper absorption and avoids complications. Here's how it's done. First, hands are washed and gloves are worn. The medicine is drawn into the syringe carefully. The skin is cleaned with an alcohol swab. The needle is held at a 90-degree angle and inserted smoothly into the muscle. After a quick check for blood, the injection is given slowly. The needle is withdrawn, gentle pressure is applied with a swab, and the syringe is safely disposed into a sharps container. After an intramuscular injection, mild soreness is common. Max is observed for a few minutes to ensure there's no reaction. Gentle movement of the arm can help ease discomfort. And that's how a tetanus toxoid injection is safely given after an injury. For more clinical skills explained simply, subscribe to Doctor's Desk.